Many thanks for staying with us. You're still watching Good Morning Namibia right here now. Last week, the Namibia Food Security Alliance, or NAFSAN, hosted a parliamentary engagement series with parliamentarians and support staff. These sessions focused on the pressing issue of malnutrition in both its forms of overnutrition and undernutrition. And joining us with more information is nutritionist from the Nutrition and Food Security Alliance of Namibia. That's Carmen Letlahoya, as well as Maria Kanjungu, who is the head of projects at the Namibia Nutrition and Food Security Alliance of Namibia. Ladies, a very good morning. Thank you for being with us this morning, and thank you for being here on this very important subject here.
Thank you for having us. Good morning. Thank you for having us. Good morning.
Great stuff. Perhaps, Maria, we can begin with you. Just talk to us about that engagement last week with this parliamentary standing committee and perhaps the outcomes of that engagement here.
So the engagement is part of our EU-funded project where we are targeting to engage a series of stakeholders, including journalists, private sector, and then the lawmakers. So we started last year engaging lawmakers, and last week we engaged the National Assembly. We will engage this week the Children Parliament, and the following week we'll engage National Council. So the idea is really just to advocate for policy changes, to advocate to create awareness around the current status of malnutrition in the country, to give lawmakers information so that they can make informed decisions and improve or develop policies that improve the lives of our people.
Absolutely. I was shocked to hear that 26 children in this year alone died of malnutrition in the area of Khobabas. In 2024, you'd think that this is perhaps an issue of the past, and I'm glad that we have experts in the room, nutritionists in the room, to really help us understand what the issue of nutrition means to Namibia. I mean, we speak of overnutrition, we speak of undernutrition, we use terms such as malnutrition, etc. Ms. Letlahoya, perhaps you can speak to us. What is the current state as far as nutrition is concerned in the country, from your perspective as NAFSAN?
From my perspective, there's actually a lot that needs to be done. People are really hungry out there, honestly. It's as blunt as it can be said. People don't have enough to eat. And malnutrition goes beyond just food insecurity, because there are underlying issues like unemployment, poverty, already in the drought, that was just announced,
absolutely,
it just made things even worse, because already you have limited resources, and now you have these underlying issues. So that's why currently in the country, honestly, we need different stakeholders to come on board so that we can tackle malnutrition as a whole, whether it's over and under, but obviously with under being the main priority, yes, right now. So honestly, we have a lot as Namibians that we can do and we should do. We should stand together to just tackle this situation.
Very much. You're a nutritionist by profession.
Yes.
Just for the sake of our viewers and for my own interest as well, what do we mean by when somebody is undernourished or malnourished here? To understand the context of it, and at what point somebody is considered to be suffering from this condition.
Okay, so when we say malnourished, it's actually including both over and undernutrition.
Okay.
So undernutrition is when you don't have enough to eat, or when your body is not consuming enough. So
nutrients. Yes.
Right, nutrients. Yes. So you have 4 types of undernutrition. So you have wasting, you have stunting, and you have undernutrition, and then you have hidden hunger, and that's now micronutrient deficiencies. And then you have overnutrition, which is also part of malnutrition, where you have obesity and overweight, and then overdose of micronutrients. So malnutrition is just the umbrella, and then you have the subsections.
Very much. Thank you for that clarity. Ms. Kanju, perhaps we can come back to you and reflect again on that engagement. What are the sentiments from the parliamentarians regarding the situation, and just how high up the agenda did the issue of drought, of course, form part of this agenda and discussion points here?
So, like Carmen said, drought has made things worse.
Absolutely.
Because at the core of malnutrition, as much as there are other contributing factors, it's really food insecurity. And so now with drought, it means many people have lesser to eat than they had before. Food is now going to be more costly. And so that really really made it more urgent than ever for us to engage policymakers, for them to understand when you're speaking of drought, it does not just affect the farmers, it also affects individuals, and it will worsen the situation and would have more children that are ending up dying. So the sentiments that we're getting from the parliamentarians are that it is high on their agenda as they go on break this week. They are going to do oversights across the country, and one of their main focus is malnutrition. So they are going to assess hospitals across the country. And they were very thankful that we really engaged them prior to that, because then it enables them to get that right information from our nutritionists of what do we talk about when we speak about undernutrition, for example, a stunted child or a wasted child. What is that? What is the difference? Etc.
Carmen, you've been on the ground, you've seen the situation. What are the sentiments? Talk to us about what the situation looks like on the ground. I mean, it's nice of us to sit here and say, issues of nourishment, etc., etc. But obviously, it's a different picture on the ground here.
Yeah, definitely, it's a way different picture than even described. It's sad what's on the ground. Honestly, we are very privileged to say we can even eat 3 times a day, because there are so many stories out there that you are hearing of families that at the core, most of them are saying, we just don't have enough to eat. And then you have the underlying issues of, what I mentioned, unemployment and poverty that makes it even worse. And then you do get those that are willing to start, backyard gardens and all of that. But water is another issue for them.
Absolutely.
So it's one of those things where you're advocating for people to eat the right food and all of that, but they have issues of water where you can't even produce, anything. And then you get situations where parents are giving children sugar water, and because there's nothing else to eat. And it could be that the mother also doesn't have enough breast milk. And another situation that, what's just very shocking is you get ready to use therapeutic food at the hospital for this recovering malnourished child. The entire household is sharing it. So this child doesn't even get to the point of recovering fully, which then makes the child end up back in the hospital. So it's really
a vicious cycle.
It's a vicious cycle, and these families, they are really just trying their best at the end of the day.
Well, we've also heard from the governor of the Omaheke region. I'm using the Omaheke region as a case in point because I'm still, shocked that, we could lose lives to such a matter. We've often spoken about building on food security in the country, etc., and losing 26 lives because of inefficient food, it's heartbreaking. It's something that we should reflect on as a nation. But hearing the governor also mention, the social issues and how they've contributed. People are selling this drought relief food to aid their drinking habits or whatever other habits they may have. How big of a driving factor, just coming back to the social issues, how big of a driving factors are these issues to where we find ourselves as far as these nutrition shortcomings are concerned here?
They have a big influence as well, and that's why malnutrition, you can't just look at it from one point. It's a multifaceted, complex situation where you have to include, like you said, all the social issues and all of that, because besides them selling the food for, alcohol and all of that, it's also a thing of child neglect, It's a thing of child birth spacing. Like there are so many teen parents with children under the age of 5. Cultural beliefs that also impact, the food choices. And there's wrong feeding practices, There's so much that needs to be tackled at once when you want to address the situation. So it's a multi-sectoral approach that we have to use in order to tackle malnutrition as a whole. So you can't just have, you provide food for them, but now we have the issue of they're selling it. So people also need to be educated on, the importance of, eating well and why. They know why alcohol is bad for them, but, it's a habit again. So there are so many players that are needed in order to tackle this
issue indeed. Where do we begin, Maria? As head of projects, we've started the conversation with our lawmakers. Our lawmakers are going out into the field now. They will assess, they will get a first-hand account, first-hand experience of just how dire the situation is. But obviously, as you heard from Carmen, it requires a multi-sectoral approach. It requires a number of stakeholders. Where do we begin?
So thank you very much for that question. And thank you for using Omaheke as case in point. Right now, we are working with the regional Ministry of Health Directorate and the local civil society organization to develop what we are calling as a post-discharge strategy.
Okay.
This is looking at reducing the number of admissions, severe malnourished kids that are ending up in hospital, and that vicious circle that we're talking about, them ending up readmitted. So we're looking at what support can you give this child. Okay. So we are assessing them while they're admitted to look at what are their core conditions. Is it food insecurity? Is it negligence? Is it wrong feeding practices? And what then social services or support can you link them to? Do they need social grants? Do they need to be taken to a counselor? So we are developing that in with the Ministry of Health to look at beyond the Ministry of Health, because they are doing the treatment and they are sending this child back to a household where they came from, where the same issues will still prevail, and they'll come back. So now we are in the process really of developing that strategy, which would then look at what are the other sectors that need to come in and what will be their role. We are also working with the national level here, including the executive directors, to pilot it in Omaheke first, and see how could that work, how could it not work, and then we'll be able to integrate it in the Ministry of Health systems and other stakeholders, and then also expand it to the rest of the country, because the situation is not just dire in Omaheke. Currently, Ochodonjupa is picking up because of the drought situation, and of course the up north will pick up because low rain meant no food to eat.
What is the timeline on this? We do not have time. In fact, we should have arrested the situation yesterday already.
So right now we are still in the drafting space of it. We are engaging a lot of engagement between really civil society and the Ministry of Health, whether the regional part and us is taking place. We are hoping by August latest we would have started with piloting this strategy. It would still need the approval of the ministry, of course, but we are very hopeful that by August, perhaps by August, we can start.
Very much indeed. Thank you for being here. Come on, your final sentiments, just briefly, so yes.
I'll just go back on that. Malnutrition cannot be seen as just food insecurity. It goes beyond it, and so anyone and everyone that can come on board, it will be appreciated.
Very much indeed. Thank you for being here. All the best with your work at NAFSAN. All the best with tackling and arresting the situation.
Thank you very much.
There you have it.